All right, that's your wrists. Okay, next we are going to test for what are called postural distortions. These distortions could put more weight on the joints of one side of your body compared to the other. If that's the case, you're going to be wearing out one set of joints faster than the other, so you could get an unequal wearing and tearing of those joints. So number one, now let's have everyone can sit down, pick up your survey so you don't get it all scrunched. And if you're able to, I'd like you, well, you could take your shoes off, or you can just take a look at your heels, okay? So if you take your shoe off, what we're going to look at, when we're examining a person and how well their gait is, how good the gait is, we look to see the wear pattern on the heel and on the ball of the foot. So here you can see, like on mine, it's pretty even in the center of the ball. It's worn pretty evenly there. But it's worn a little more on the outside edge. That's a little more typical of the way that people hit, because their heel often strikes slightly on the outside and curls inward. So what we want to do is take a look at both shoes and see, is one of your heels more worn out than the other? It's less likely that that is due to the fact that your shoes were manufactured by two different companies. You know, usually they're going to be using the same material on both shoes. It's not because one is a softer material than the other. So you can check both, look back and forth, or you can take your shoes off and compare the two and see if one is worn down a whole lot more quickly than the other. And if it is, it indicates that you're striking with one heel harder than with the other heel. And it could be also, depending on where it's wearing out along the edge of the heel, it will tell you where you're striking the foot. Now some people walk, and typically your feet should be fairly straight when you're walking. Now and I've been doing this for many years, observing people and their walking, how they walk. And so, and you can do it too, you probably, any of you people watchers? Anyone like to watch people? Absolutely. It's fun, huh? People are very interesting, I think. I love that. And so when we're watching, for example, as he's coming in, if you watch how he walks, you watch his feet.
I just want some water.
Yeah. I'm just pointing out the postal carrier over here who just is visiting here, getting water at the drinking fountain. Yeah, we could. But as he leaves, pay attention. Which is all right too. So when he's walking, his right foot is angled out a bit more than the left one. All right. So his shoe's going to wear very differently. It'll wear out more around this side than more in the center, and this one will wear a little more in the center. So when we're analyzing how a person's walking and the different joints, where the wear and tear joints are, then we look at the shoes as well. We will look at leg length also. Someone's lying on the table. We pull the legs out to see if they look even. It could be that the hips are rotated. We have 3 bones in the pelvis. We have the 2 pelvic bones that start at the pubic bone. It's sort of like this, if this is the pubic bone. They each come here. And then in between my fingers here is where the sacrum is. It's a triangular bone that's the base of the spine. And so there's a joint here, there's a joint over here, and there's a joint over here. There's 3 joints. So because it can rotate this way or it can rotate that way, it should move freely as we're walking if everything's working properly. However, sometimes the sacrum coming in here will jam on one side. It'll move freely on one side and start rotating on the other. That will create a distortion in how we walk. The joints will wear unevenly. And also, it can cause one leg to go down farther than the other, because the hip joint is in the socket on one side, and so if one's rotated down a little and the other relatively rotated up, that'll cause the leg length to go like that. So you might be walking around like that. It can be very subtle, but there's still... How many steps do you think you take in a day? Anyone wear a pedometer? You wear a pedometer? How many steps?
Oh, about 15,000.
15,000 a day. Wow, you're a champion. You're a champion because, you know, even I know that I've worked at Kaiser before. I worked in the, doing acupuncture up at Kaiser Richmond for a year. And I also worked with Kaiser. They refer a lot of people for work comp injuries to me as well. And so, so when I was at Kaiser, they were giving all the employees pedometers. Are you work for Kaiser?
No, that's where I started.
Oh, that's where you started? Oh, all right. All right. And so a lot of people have pedometers. And I know that in the course of a day, I'd do maybe 8,000. That's just walking around the hospital going here and there. So, but 15,000 is amazing because I know that they suggest, well, try to do 5 to 10,000, maybe 8, somewhere in there. That's a good amount of steps. But that's a lot of steps. So if we're doing a step and a slightly less hard one, over time that's a lot of impacts that are going on in the joints. That's an uneven thing. And so you can get arthritis in a particular joint on one side more than the other because things are not aligned properly. Does that make sense to you? All right, so we're looking at postural distortions. That's what this is. So we looked at our shoes, the bottom of the shoes, to see if the wear pattern is different.